I'd like to welcome everyone to meeting number 14 of the House of Commons Standing Committee on Health. Pursuant to the orders of reference of March 24th, April 11th, and April 20th, 2020, the committee is meeting for the purpose of receiving evidence concerning matters related to the government's response to the COVID-19 pandemic. Today's meeting is taking place by video conference, and the proceedings will be made available via the House of Commons website. As at last meeting, the website will always show the person speaking rather than the entirety of the committee. So I'll go through a little bit of housekeeping in order to facilitate the work of our interpreters and ensure an orderly meeting. I'd like to outline a few rules. Certainly, interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either floor, French, or English. At the bottom of the screen applies if you're using a personal computer. If you're on an iPad, it's slightly different. Before speaking, please wait until I recognize you by name. When you are ready to speak, you can either click on the microphone icon to activate your mic, or you can hold down the space bar while you are speaking. When you release the bar, your mic will mute itself, just like a walkie-talkie. So a reminder that all comments by members and witnesses should be addressed through the chair. And should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raise hand function. This will signal to the chair your interest to speak. In order to do so, you should click on participants at the bottom of the screen. Once again, if you've got a PC, when the list pops up, you will see next to your name that you can click raise hand. When speaking, speak slowly and clearly. And when you are not speaking, your mic should be on mute. The use of headsets is strongly encouraged. If you have a microphone on your headset that hangs down, please make sure it is not rubbing on your shirt during your questioning time. Should any technical challenges arise, for example, in relation to the interpretation, or if you're accidentally disconnected, please advise the chair or clerk immediately, and the technical team will work to resolve them. Please note that we may need to suspend during these times, as we need to ensure that all members are able to participate fully. Before we get started, can everyone click on the screen in the top right-hand corner, ensure they are on gallery view. With this view, you should be able to see all the participants in a grid arrangement. It will ensure that all video participants can see one another. And during this meeting, we will follow the same rules that usually apply to opening statements and questioning of witnesses during our regular meetings. Each witness will have 10 minutes for an opening statement, followed by the usual rounds of questions from members. I would now like to welcome our witnesses. From the Department of Indigenous Services, we have Ms. Valerie Gideon, Senior Assistant Deputy Minister, First Nations and Inuit Health Branch. Dr. Tom Wong, Chief Medical Officer and Director General, Office of Population and Public Health. And Chad Westmacott, Director General, Community Infrastructure Branch. From the Inuit Tapiritit Kanatami, we have Nathan Obed, President, Aluki Kotierk, Member of the Board and President of Nunavut Tungavik Incorporated. From the National Association of Friendship Centers, we have Christopher Shepard, Boat, President, and Jocelyn Formsma, Executive Director. And finally, from the Southern Chiefs Organization Incorporated, we have Grand Chief Jerry Daniels. So welcome everyone, and we will now commence with statements from the panel. Each group will have, as I said, roughly 10 minutes to speak. We'll start with the Department of Indigenous Services. I presume Ms. Gideon, please go ahead, 10 minutes.
Thank you very much, Mr. Chair. So I'd like to thank you for inviting me to appear before this committee on the issue of COVID-19. I want to begin by acknowledging that I am on traditional territory of the Algonquin people, and I'm here today along with my colleagues to discuss the unique strengths and also challenges faced by First Nations, Inuit, and Métis in preparing for and responding to COVID-19. First Nations, Inuit, and Métis know their communities and their community members. They know what will work and what will not work. The effectiveness of the government's response to COVID-19 among Indigenous peoples relies on our ability to listen and provide support, tools, resources, and reliable and timely information communicated in a culturally informed way. The challenges faced today by Indigenous peoples are related to poor social determinants of health and higher rates of respiratory and chronic diseases. These challenges are well documented in countless detailed studies, including the Royal Commission on Aboriginal Peoples, the Truth and Reconciliation Commission, and the Missing and Murdered Indigenous Women and Girls Inquiry. These challenges are highly relevant to the COVID-19 planning and response required. Lessons learned from H1N1 demonstrated the importance of connecting health to the social determinants of health in pandemic planning. The establishment of Indigenous Services Canada has strengthened the government's ability to focus its efforts, aligning the public health response with supports in social programs, critical infrastructure, and broader emergency management. As well, investing in pandemic planning capacity and readiness across communities was also an important lesson learned. With budget 2019 resources of $79.9 million over 5 years, Indigenous Services Canada proactively invested in First Nations capacity at the regional, tribal council, and community levels in health emergency preparedness. The department also established a public health emergency network made up of regional medical officers and regional coordinators, including in emergency management, environmental public health, and communicable disease emergency coordinators to advise and support First Nations across provinces. While this capacity provided an important foundation, the need for communities and the department to adapt broad pandemic plans to the unique context of COVID-19 requires additional support and resources. It is also equally important to recognize the need to expand the support to First Nations in the territories, Inuit, Métis, self-governing nations, Indigenous individuals living away from their communities, and those Indigenous communities within urban centres. This is why the Government of Canada invested $305 million in the Distinctions-Based Indigenous Community Support Fund. These funds are provided to communities while maximizing their flexibility to respond to the immediate needs of their members. It includes an urban and regional Indigenous organization envelope of $15 million. Some of the needs being addressed through the Community Support Fund are food subsidies for households, supports to control non-essential travel in communities, surge capacity costs for staff, critical equipment and supplies, and mental health supports. In addition to the Indigenous Community Support Fund, the department is working with other federal colleagues to ensure that First Nations, Inuit, and Métis individuals access the broader COVID-19 economic response plan benefits available to workers, families, and businesses. $10 million will be provided to Indigenous Services Canada's existing network of 46 emergency shelters located on reserve and in Yukon to support Indigenous women and children fleeing violence. Approximately 329 First Nations communities have been served by Indigenous Services Canada's funded emergency shelters. On April 18, the Government of Canada announced up to $306.8 million in funding to help small and medium-sized Indigenous businesses and to support Aboriginal financial institutions that offer financing to these businesses. These measures will help 6,000 Indigenous-owned businesses get through these difficult times and play a key role in the country's economic recovery. Economic prosperity is an important determinant of health, particularly when you consider the younger age distribution among Indigenous peoples. In terms of my department's specific public health measures, I wish to highlight some of the core elements and activities of the response to date. While the exposure and number of confirmed cases among First Nations and Inuit to date have been relatively limited, 0.01% of the total First Nation on-reserve population compared to 0.09% for the rest of the population, vigilance is essential as the numbers are gradually increasing. Communications and protocols have been critical, with multiple visual and social media channels being utilized and a heavy emphasis on adapting national public health guidance to target community priorities, including physical distancing, limits to non-essential travel, personal protective equipment, home and community care, long-term care and nursing homes on reserve, non-insured health benefits medical transportation, self-screening of health providers and visitors, access to testing, and funerals. As an example, we are supporting Indigenous communities to implement adapted, culturally relevant public health measures to promote on-the-land physical distancing. Translation of materials in Indigenous languages will also continue. At a national level, weekly briefings are taking place with the Assembly of First Nations Chiefs Committee on Health, the Inuit Public Health Task Group, and with representatives of the Métis Nation. We are working closely with Indigenous, federal, provincial, and territorial partners through the Public Health Working Group on remote and isolated communities to ensure that the unique needs of these communities are met and that adequate preparedness, supplies, and response levels are in place. Weekly touch bases have also taken place with the National Association of Friendship Centers and the First Nations Health Managers Association. The department is also keeping apprised members of the Indigenous Women's Wellbeing Advisory Committee, co-chaired by the National Aboriginal Council of Midwives and Pauktutit. At a regional level, our regional officials have either daily or multiple weekly calls with Indigenous partners and work on a daily basis with provincial and territorial colleagues. As you know, healthcare is a shared jurisdiction, which raises the significance of coordination and collaboration among First Nations, Inuit, or Métis-led services with those of Indigenous Services Canada, other federal departments, provincial or territorial governments, and their public health authorities. During this pandemic, clarity of roles and responsibilities can remain a challenge, but thankfully, regional offices have spent recent years strengthening trilateral partnership tables. Relationships are well established and a strong asset in this COVID-19 response. Indigenous Services Canada plays a more direct role for primary health care in 79 remote First Nations communities and for public health among First Nations on reserve across provinces, with the exception of British Columbia, where the department acts as a funding and governance partner with the BC First Nations Health Authority. Specifically, the department has mobilized its National Health Emergency Network and regional command centers to actively support communities in updating, testing, and activating their pandemic or their all hazards emergency plans. Assessed more than 550 requests to the department's stockpile for personal protective equipment and hand sanitizer within 24 hours intended for First Nations healthcare workers. Set up emergency contracts for surge, nursing, and paramedic capacity available to First Nations health and long-term care facilities across provinces, and identified additional physicians through the Society for Rural Physicians of Canada. Worked with the Public Health Agency of Canada on the availability of swab tests where these cannot be provided by provinces, and point-of-care testing in and or near Indigenous communities when those become available. With fewer commercial flights and travel restrictions in place, the department has secured stable means to transport health professionals and needed supplies to remote First Nation communities. Finally, we have directly purchased or funded alternative infrastructure for medical purposes or for accommodation. With a focus on remote communities, retooling existing space in schools, band offices, or hotels is the preferred and fastest option. However, where this has been deemed impossible, 41 mobile medical units and 17 multi-purpose mobile trailers have been secured so far. Je crois savoir que le comité a reçu une copie du tableau de bord que nous avons.
I believe that the committee received a copy of the placemat that we developed to provide key information about COVID-19 and Indigenous communities. Indigenous Services Canada wishes, or rather, is ensuring that additional support is available through the Emergency Intervention Program, the On Reserve Health Program, the Uninsured Health Services Program, the Jordan Principle, various initiatives, and other services to support children and families. When Indigenous Services Canada is made aware of positive results of COVID-19, we work to cooperate with our key partners to ensure the availability of appropriate health care for people affected, implement immediate measures to reduce spread in the community, and identify contacts, also providing any support that could be necessary. The health and safety of community members is an absolute priority, as is the necessity of respecting the privacy of people affected by COVID-19. With flood and fire season approaching, I want to assure you that the department is working closely with First Nation communities to prevent any additional challenges that seasonal flooding and other natural disaster emergency situations may present in the midst of responding to the COVID-19 pandemic. We are working to ensure that emergency seasonal evacuations continue to happen. Confirmed and presumptive cases of COVID-19 will be assessed and treated using appropriate public health and primary care measures. Infection prevention and control measures are put into place to ensure that community members who are being evacuated are protected from being exposed. We're focused on enhancing our response efforts in key areas. We are learning and we're adapting quickly as the COVID-19 pandemic evolves. We are partnering with Indigenous organizations to ramp up and tailor communications to their needs. This includes youth, urban-based, and northern populations. We are working collaboratively with First Nations on ensuring access to mental health resources, including virtual counseling, crisis line surge capacity, and strategies to cope.
Wrap it up. You're at 13 minutes.
Okay. Enfin, nous reconnaissons.
Lastly, we recognize the large number of Indigenous individuals residing in urban centres and will continue to do outreach and collaborate with Indigenous organizations, provinces, and territories to offer extra support. I want to assure you that we are taking this matter very seriously to ensure that no Indigenous person or community is left behind. I would be pleased to take your questions.
Thank you, Ms. Gideon. Next on my list is ITK. However, Mr. Obed is having trouble connecting. We will therefore go to our next group and get back to ITK shortly. So the next group is the National Association of Friendship Centers. Mr. Shepherd, I believe, President, if you would like to do 10 minutes, please.
Good afternoon, everyone. I'm going to do the first 5 minutes, and then I'm going to hand it off to President Shepherd-Boat. So my name is Jocelyn Formsma. I'm the Executive Director of the National Association of Friendship Centers. Originally from Northern Ontario, my family is from Moose Cree First Nation, and I grew up in the surrounding area in my territory. Friendship centers have been on the front lines of the COVID-19 response since the first day. To give some examples of what they have been doing, they've been responding to increased service demands, delivering food to families, young people, elders, responding to calls for assistance, support, and found that there's additional calls around sexual assault and family violence, providing mental health and cultural supports for urban Indigenous community members, They have been asked to lead task forces or have just started them on their own, responding to the needs in urban settings. They've been asked by mainstream agencies to help deliver supports. They've been emptying their food stores, cooking food for community members, picking up and delivering food, traditional medicines. We've even had an example of a friendship center who went to a family home to deliver food, found out that the family's stove had broken down, and actually purchased a stove and arranged for it to be delivered to the home. And in another instance, found that they were delivering food to a family and found that the father was very ill, and actually convinced him to go to the hospital so that he could seek medical attention, because to him, he thought that whatever he was dealing with was safer than going to the hospital to deal with that medical issue. So although it wasn't COVID related specifically, there are so many things that friendship centers have been doing to step up in this space. The NAFC, the National Association of Friendship Centers, represents 107 member local friendship centers and provincial territorial associations operating in every province and territory in Canada except for Prince Edward Island. The services offered are as diverse as the communities in which they're located, but the key point is that they are all culturally informed and culturally appropriate. The NAFC received word from Indigenous Services yesterday that we will be receiving $3,750,000 from the Indigenous Community Fund, and that was representative of 100 different organizations, including the NAFC, 6 provincial territorial associations, and 93 local friendship centers. We certainly appreciate the support, but we know that these funds will not last long, and we welcome the opportunity to work with the government to seek additional supports for friendship centers. Friendship centers are experts in urban Indigenous service delivery. Since the 1950s, we've been working in a wide variety of our communities, from Inuvik to Montreal to Labrador and Vancouver Island and everywhere in between. Indigenous people, as we know, are diverse, and a diversity of approaches and partners are needed to respond appropriately to this COVID-19 pandemic. We know that friendship centers are already providing services, food, supplies, staffing. We need support for creating safer spaces now and in the future. We need support for equipment and information technology, software, hardware, and protective equipment for our staff and volunteers and community members. The distinction-based approach has affected urban Indigenous pandemic responses. In echoing the words from the MMIWG inquiry report, we believe and would advocate that distinctions ought to be defined with an intersectional lens, not just including First Nations, Métis, Inuit, but also considering the residents of Indigenous people, the province territory they're in, whether they're remote or northern residents, their physical and mental abilities, sex, gender identity, and sexual orientation. We believe that by including an intersectional lens to distinctions, we will better be able to provide wider and greater supports for urban Indigenous community members. And just to provide the committee with a bit of context, we have found in the early weeks that jurisdictional wrangling had an effect in our ability to respond. We, as the National Association, immediately went to Indigenous Services, receiving word that the provinces and territories would have been expected to step in within the urban spaces for Indigenous people, but in connection with our provincial territorial associations, they were finding that provinces and territories, when they went to them for support, that they were saying that we should be going to the federal government for financial support. So this led to a lot of running around for friendship centers and nobody fully taking responsibility. So we know that First Nations, Métis, Inuit are a priority group for testing, and for they're a community of concern for the virus. And so we just want to ensure that urban Indigenous voices are considered, that our communities are considered in whatever approaches are taken to respond to this pandemic. And I'll hand it off to President Shepherd-Bout to wrap up our comments.
I'm going to take a little bit of a different frame, I guess. in that what I'm really concerned about, more than the timing and everything else, is that the government of Canada continues to frame urban Indigenous communities as somehow different or separate from our relatives who continue to live in their respective historical or current territories, where friendship centers since the 1950s have been the direct result of Indigenous self-determination, designed to be a support foundation for the presence of Indigenous people in cities, and for many reasons ending up there to have a safe haven that was fabricated from Indigenous ways of knowing, outside and beyond historical government-determined boundaries. And where current data continues to show that Indigenous people will continue to move to urban centers, the numbers will continue to increase in urban centers. Systems, programs, pandemic planning, public policy is still crafted from a perspective that does not appropriately reflect where Indigenous people live. This can be most easily seen currently during this health crisis, where the majority of the support fund did not require a request for proposal process, whereas urban people were required to create a proposal. It required our national association to, in most instances, intervene in the work they were doing on the ground to ask questions to make sure that we were getting the appropriate data to complete an application to get support to help our organizations on the ground. And while friendship centers historically have been designed as wraparound civil society organizations, we've been fighting this notion that across the spectrum of program design within federal systems, there's very little space for urban people. And this current situation is highlighting other problematic realities compounded as well. So when you look at what are historically ineligible items that you can support your community with, like food security, in a time where food security is one of the biggest barriers in our communities, and our organizations know it's not typically an eligible expense, it takes a lot of written confirmation before they will be comfortable spending those resources, because they have a huge fear of being told that what they're doing is actually ineligible. And I'll finish with, it may seem unusual to a lot of people right now that you go to work every day really fighting to keep people alive, but this is actually a normal occurrence at our organizations all the time. COVID-19 and keeping people alive is not, it's not strange territory for us. When you have urban people who are borderline invisible and not quite distinct enough, it takes an incredible amount of work and energy and response to make sure that they have the best health outcomes every single day. And so it's very normalized for our organizations to not even consider closing and to keep working, because this is their everyday. And my hope is that as we move forward, policy responses to health crises like we're in right now, that those responses are actually representative of what the reality is for urban people and for Indigenous people in this country. And that out of 305 million, 15 million is set aside for where the majority of us live. Thank you.
Sorry, I think had a muting problem here. So we'll go now to the Southern Chiefs organization with Grand Chief Jerry Daniels, Gun Chief. Please go ahead. 10 minutes, please.
Thank you, Ron. Hope everyone can hear me well. I would like to start by acknowledging that although we may not be together in the same place for this meeting, we are all on Turtle Island. Indigenous peoples have been on this land since the first sunrise. I want to take a moment to acknowledge our elders who are the keepers of our knowledge and culture and who are at risk, increased risk during this health pandemic. I want to acknowledge all the people who are working hard on the front lines and behind the scenes to keep Indigenous nations and Canada safe from COVID-19. I would like to acknowledge the leaders and community members on the ground who are putting themselves at risk to ensure the operations are maintained and families are taken care of. Whether it is running errands for others, delivering supplies such as groceries, water, or medicine, or standing for hours at the road checks to help flatten the curve, I want to say, Chimigwech, thank you from the bottom of my heart for doing the work and being the backbone of this country right now. I thank the committee for the work you are doing and for inviting me to speak today about Canada's response to the COVID-19 pandemic. I will speak about how the pandemic is impacting Indigenous, Anishinaabe, and Dakota people in what is now southern Manitoba. I hope that this meeting will be fruitful and further inform the way forward. In my presentation, I'm going to focus on 4 key determinants of First Nations health, how they're impacted by the COVID-19 pandemic, and what is needed to effectively support our communities. At the heart of the determinants of health are inequalities in the health system. The inequalities with federal funding and ongoing inequalities the communities are facing that make our elders and youth so vulnerable. I begin by focusing on health inequalities that First Nations people face in Canada. When it comes to accessing healthcare services and professionals, Indigenous peoples are the most marginalized in the country with the poorest health outcomes. As just one example, a joint study released last year by the First Nations Health and Social Secretariat of Manitoba and the Manitoba Centre for Health Policy demonstrated decades of poor health outcomes have resulted in a gap in life expectancy between status First Nations and all other Manitobans that now sits at 11 years. Shockingly, this 11-year gap is growing. This lack of access to healthcare has allowed to develop over decades and many administrations. First Nation reserves are often remote and far from major cities where there is better access to healthcare. It is important to remember that displacement of Anishinaabe and Dakota nations made way for those cities, such as Winnipeg and Brandon, with large health hubs and resources. I am concerned about our fly-in communities, such as Poplar River, Pungassi, and Little Grand Rapids, that are particularly vulnerable in this pandemic. When the rest of the country comes to a halt or adjusts their production, transportation, and distribution schedules, the impact hits our remote communities hard. They rely on supplies and health professionals from outside their communities. And for First Nations living off reserve, we only need to think of the death of Brian Sinclair to know that racism and stereotypes can be deadly in our cities as well. As we continually check in with our communities, we hear their concerns. And I can tell you, as of yesterday, Little Grand Rapids is experiencing a shortage of liquid baby formula at their northern store. We ask that the systemic inequalities be addressed once and for all with increased access to healthcare on reserve with special consideration for remote communities. Sadly, the inequalities continue with the response to COVID-19. While we applaud the steps taken by this government with Indigenous Community Support Fund and are encouraged by the aid announced over the weekend with the Indigenous businesses suffering COVID-19 losses, there's a monumental financial shortfall that will cause hardship. This past Friday, CBC's Power and Politics host Rosemary Barton estimated that an unprecedented $113 billion has been allocated to help Canada thus far with the pandemic. Only $621 million is earmarked for Indigenous communities. The 2016 Canadian census reported that Indigenous peoples accounted for 4.9% of the national population, yet Indigenous people are receiving just over half of 1% of the relief funds allocated by Ottawa. This is clearly disproportionate, and First Nations are still left managing poverty. While the argument may be that First Nations are eligible for some of the billions in aid that are eligible for regular Canadians, for example, the increase in GST rebate or child tax credit, it will not be close to the extent that would close the gap between the $621 million and the $113 billion. We ask that the funding for Indigenous Community Support Fund be increased to equitably reflect the First Nations population and realities created by many consecutive Canadian governments. We ask that any proposal processes move quickly to approval stage due to the state of emergency we find ourselves in. Another area of concern are off-reserve members of our communities. Approximately half of First Nations population now live off-reserve and in urban centers. Yet we are not funded to care for our off-reserve members. Chiefs are receiving calls every single day asking for help. With just 15 million of the Indigenous Community Support Fund allocated for urban Indigenous peoples and divided between First Nations, Inuit, and Métis organizations across the country, it is simply not enough. We ask that the funding for off-reserve services be increased to appropriately reflect population dynamics in urban centers. I will now take a moment to highlight other inequalities that impact First Nations, specifically food security and infrastructure deficits. When it comes to food security, Indigenous peoples have been precariously and vulnerably in vulnerable situations since the disruption of our agricultural and hunting economies. Because so many of our families are already experiencing food scarcity, this crisis has made this situation so much worse. We rely on strong partnerships like the one with the Breakfast Club of Canada. Our 34 communities applied to their COVID-19 emergency fund with a low barrier application and fast response of Big Miigwech, the Breakfast Club of Canada, for your strong support. As First Nations, we have always hunted, fished, and trapped to survive and feed our families. In this time of crisis, with restrictive movement to the surrounding cities and municipalities, we are trying to return to traditional food sources and harvesting to increase our food security. We ask for financial help to support the implementing of community food security projects. The COVID-19 pandemic has reinforced that there is a lack of housing and a poor quality of existing infrastructure on reserve. Where do you isolate in community when there's chronic housing shortages and more than a dozen people in one home? There's a lack of on-reserve facilities and resources for community members struggling with addictions. While we applaud the $50 million allocation for women's shelters and sexual assault centers, which includes up to $10 million for facilities on reserve in Indigenous communities, more is needed. There's only 46 shelters funded by Indigenous Services Canada across the entire country. We ask for more investment in First Nations infrastructure for housing and facility shelters. Lastly, I would like to speak about the well-being of our elders and our youth. From conversations with our chiefs and members, we know that many are concerned about the safety of our elders and the virus that disproportionately kills older people. Elders are sacred in our community. Not only are they much-loved members of our family, but they carry our culture and knowledge and languages and our histories and traditions. If the disease hits our communities, the personal care homes, like it has in other provinces, it would deal a heavy blow to the intergenerational knowledge systems of our people. We need our elders close and cared for, and we need more homes on reserve. Because our elders are not always treated well in personal care homes off reserve. We have just 2 personal care homes for elders in all of our 34 communities. I want to acknowledge thank the hard work and dedication of Manitoba First Nations Personal Care Home Network, our leaders of the on-reserve care homes in Manitoba. Our communities are also worried about our youth, especially those in post-secondary education. The economic fallout poses a real risk with no summer job prospects this year and no childcare to support single parents. Attending post-secondary this fall may not be possible. Indigenous youth have some of the highest rates of suicide and self-harm in the country and are overrepresented in the child welfare system. So mental health supports and resources to keep youth engaged during this time of isolation are critical. We ask for a measurable increase in mental health supports and a new commitment to address addictions on reserve. We ask for an investment of 4 additional personal care homes that can serve Anishinaabe and Dakota elders in our communities. I have spoken of the current health inequalities and of the inequitable response to COVID-19. I have spoken of the food security infrastructure challenges exacerbated by the pandemic. But as I conclude, I want to leave you with a new vision, a vision of health transformation. First Nations do not want to inherit a broken system, a broken health system, but to create a wellness model with our governance and our values, a new and groundbreaking health system for all Southern First Nations communities that will begin to close the gaps. And we are days away from signing a memorandum of understanding with Canada to make this happen, because I should not die a decade before you, because I am an Anishinaabe man. And my son should not die a decade before your child, because he is an Anishinaabe. Let's work towards the Truth and Reconciliation Commission of Canada's Call to Action 19 and identify and close the gaps in healthcare outcomes. Reconciliation can mean letting go of the structures and the faulty dynamics that have plagued our relationship for generations. Statistics and reports document the legacy of systemic neglect and negligence in the healthcare system for First Nations. But together, we can build a new future founded on true partnership as the treaties intended. Miigwech.
Thank you, Chief. I see that Mr. Obed has been able to join us. I'm sorry for the connectivity issues. We go now to Inuit Tapiriit Kanatami. Mr. Obed or Ms. Kotiuk, please go ahead with your statement. 10 minutes, please.
Nakwamik, thank you. Yes, I'm glad that I was able to get on. Inuit Tapiriit Kanatami is the national representational organization for the 65,000 Inuit in Canada, the majority of whom live in Inuit Nunagat, our homeland. And that encompasses 51 communities over approximately a third of Canada's landmass. All but 2 of those communities are fly-in, fly-out communities exclusively during the winter months, and only a handful of those communities are serviced by marine ferry during the summer. ITK is governed by the elected leaders of the Inuvialuit Regional Corporation, Nunavut Tungavik, Makivik Corporation, and the Nunatsiavut government. These 4 representational organizations and governments are Inuit rights holders under Section 35 of the Constitution, having negotiated comprehensive Inuit Crown land claim agreements between 1975 and 2005. It is therefore appropriate that the Crown engaged Inuit rights holders in the COVID-19 response. ITK has helped facilitate regional engagement with the Government of Canada throughout this process through our national government structures. There's a very large gap between Inuit and non-Inuit Canadians on key measures of importance to health, such as housing, income, food security, and access to medical care. A few key examples in relation to COVID-19 are that 52% of Inuit and Inuit Nunagat live in overcrowded homes, whereas only 9% of non-Indigenous people in Inuit Nunagat live in overcrowded homes. The median income level for Inuit and Inuit Nunagat is $23,000, whereas the median income for non-Indigenous people in our homeland is $92,000, which is about 4 times greater. In many of our communities, individuals are often multiple flights and days away from emergency or intensive care, as we have health centers instead of hospitals in the majority of our communities. COVID-19 poses a particularly high risk to the health and well-being of Inuit living in Inuit Nunagat and also in urban centers. It's crucial to understand the unique and considerable vulnerabilities that create these negative outcomes in both illness and disruption in service in Inuit communities. And we have been working with the federal government throughout the last 6 to 8 weeks in regards to an Inuit-specific distinction-based response. There are 3 considerations that I'd like to discuss today. The first is in relation to public health measures to prevent the circulation of COVID-19 in our communities. And it starts with testing. We've struggled with the limited availability of testing and long turnaround times. This has also been in our experience in our TB epidemic, and there are significant negative consequences of not having immediate results or results within a short period of time. The identification of the presence of COVID-19 quickly in our communities will then be key in our response, as it is in any community in the country. And considering that now there aren't regular flights the way that there were daily flights previous to the restrictions that have been put in place in our regions due to COVID-19, then people might get tested, but there might not be a flight for a number of days. And then that test also waits in a queue once it gets to a southern center for processing. So the rate of active cases and the data that we use to then respond to this crisis depends upon rapid access testing. So we commend the federal government for moving quickly to acquire point of care and near care tests, and also prioritizing remote communities for the placement of these tests. We understand that Inuit communities are of key consideration in this national response, and that the federal government understands that there is an urgent need for these point of care near care tests. Also, Inuit-specific public health guidance. We've done really well so far to minimize COVID-19 and its entry into Inuit-Nunavut communities. Two regions, Nunavut and Nunatsiut, have not registered a confirmed case yet, and there are just a handful of cases in Nunavik and just a couple in the Inuvialuit region. But we need to ensure that we are working as closely as we possibly can with provinces and territories and their public health and data systems, as well as the federal government all the way through. And we have an Inuit Public Health Task Group that facilitates this work. And we commend all parties, from the Public Health Agency of Canada to Health Canada to Indigenous Services, to then provinces and territories in which Inuit live, to try to work through a number of challenges that are gray areas of governance. Sometimes there are processes that don't require Inuit participation through legislation, but we are living in a time of reconciliation, and the more information and the more open communication between Inuit rights holders and public governments, the better in relation to this crisis. And we see that through the shared health promotion strategies that we want to invest in and help deliver it for our communities. Inuit communities are known to have high rates of risk factors for poor outcomes in relation to COVID-19, based on things like our smoking rate, or poor nutrition, or poverty, and also the active cases of tuberculosis in our communities. So the support for programs that contribute to a reduction of smoking rates and improve food security and nutrition are key to protecting Inuit from COVID-19. Also, that the ongoing ambition that is a shared ambition between Inuit and the Government of Canada to eliminate tuberculosis by 2030 also comes into play when we're dealing with COVID-19. And there are many different synergies in the types of responses, especially in consideration to things like housing. So we'll continue to work with the federal government to provide funding to Inuit representational organizations that allows them to implement strategies to improve food security, enhance hygiene, and promote physical distancing in Inuit communities, including on-the-land programs, elder support, and increased access to water service and cleaning supplies. The second point is in relation to health systems, and the necessity for our health systems to continue to function in COVID-19. So we need to ensure that the connections remain strong between Inuit communities and the service agreements that jurisdictions have with Southern Care facilities in relation to COVID-19. And then also we work directly with the federal government for any immediate point of care considerations for COVID-19 responses if there were many cases in our communities. And we've talked with the federal government about possibly employing federal resources and military or Navy resources in relation to response. But hopefully we can continue to have those strong connections between the care that is provided to us in the South and also in regional centers in Nunavut, and also then in communities in COVID-19 response. We're concerned about the shortages of drugs and supplies and staff. And so there are many different HR considerations, especially considering that many of our communities are staffed by only 1 or 2 nurses at a time, and that there is a huge push on resources for in the healthcare response in the South. So that is a consideration that is top of mind. Then also things like drugs for tuberculosis, such as the BCG vaccine, and worldwide shortages in relation to that. So there are a number of different considerations that we continue to work with the federal government on in relation to the COVID-19 response. The third point is in relation to air transportation, and ITK has made it clear that we see air transportation as an essential service. There are no other ways to get to our communities at this time of year, and the way our healthcare system, the way all essential services flow in and out of our communities that depends upon our air carriers. In other parts of the year, we will have major considerations for sea lift resupply and cargo traffic. But at this time, it cannot be overstated how important air links are and federal support for those air links across Inuit Nunangat to remain intact. The last thing that we want is for any of our existing airlines to not be able to continue to operate, because that would place a massive consideration and risk on those populations in our communities above the already difficult challenges that we face. We'll continue to work with the Inuit Public Health Task Group. We'll continue to work with the Government of Canada. But any of the work that we do, whether it's with you in this committee or anywhere else, is focused on an evidence-based, globally informed, and Inuit-specific response. And we look forward to working with you under those terms to ensure that Inuit are not adversely affected even more than we already are in relation to the COVID-19 response.
Thank you. So we will start our rounds of questions at this point. Before I do, I just want to point out, Chief Daniels, when you were speaking, we were picking up a fair bit of noise on your mic. So when you're answering, just try to hold your mic out away from your body if you can. And also, if anybody needs to leave to go get a coffee, just leave your video on, because if you turn it off, your picture gets moved all over the screen and it's hard to keep track of where you are. So with that, I'd like to thank everyone for their statements. Excellent information. We start now with our first round of questions with Mr. Vidal. Mr. Vidal, please go ahead. You have 6 minutes.
Thank you, Mr. Chair, and I want to thank all of the witnesses for taking the time and making the effort to come and be with us today. It is appreciated. My first question is for the National Association of Friendship Centers, and I'll let the two of you decide which one wants to answer. As has been referenced a couple of times, the $305 million that was announced by the Indigenous Community Support Fund, out of that $305 million, $15 million was allocated to urban Indigenous organizations like yours. It was through an application-based process. My understanding from a statistical basis is that over 60% of Indigenous people in Canada live in urban centers, and that this funding represents about 5% of the funding for Indigenous organizations. Could you please just elaborate a little bit? I know you spoke to it a bit in your presentation, but just elaborate a little bit more on how maybe the underfunding of urban Indigenous organizations during this pandemic puts Indigenous people in urban centers at greater risk.
So maybe I'll start on that, and then I'll ask President Shepherd-Bout to jump in. It's been a challenge because we don't want to be seen as throwing anybody under the bus. Hence why in my criticisms of distinctions-based, we're saying there has to be a consideration for remoteness, for those who live in the north, for women, for a number of different intersections of what makes up an Indigenous person. We're trying to add a voice to say that urban, and when we say urban, we mean, we've got friendship centers in like Inuvik, and in Happy Valley Goose Bay, like not like typical big urban spaces, but they are just off reserve, typically not in Inuit Nunangat, and not typically, like sometimes they are in Métis homelands, but not part of Métis settlements. So it could be communities of over 1,000, 5,000, or in major metropolitan areas. I think the piece that we're trying to get across is the service component. So as friendship centers, we do not look at we look at people as in terms of what they need in terms of service delivery. Who they are in terms of how they identify is important to us. But we also are considering the factors that they need, and we're trying to respond to a service from a service point of view. And we don't dictate who we get calls from. with people who are living in urban spaces, if they need support and they know that there's an Indigenous organization that might have a better understanding of who they are, they're going to call that organization, and they're going to call regardless whether they're First Nations, Métis, Inuit. It's just they're there, they need something, and they need an organization that understands who they are. And so what we've been finding is, with friendship centers getting an increase in calls now, and at least in the friendship centers in BC are not just at capacity, but they're over capacity in terms of the services that they're providing. And the financial resources from any level of government have not materialized yet. Like I said, we got the notice yesterday that that we will be getting funds from the Indigenous Community Fund, $3,750,000 across 100 different organizations. As the NEFC, we chose to write a proposal on behalf of all of our member friendship centers because we did not want to have the burden put on the local friendship centers who are in it every single day. I've had executive directors say that they've been sleeping overnight in the homeless shelter because they have lack of staffing. We've had people that said we had a 25% increase on requests to our food bank, and we ran out of food in an hour. We haven't been able to get access to some of those personal equipment. We've been getting stories from across Canada on just the service needs and going from place to place to place, knocking on doors, so trying to get some kind of financial support, some kind of financial recognition that we're there, we're doing the work every single day, and it has not materialized. It has materialized in some of the local centers and some of the larger areas where, for example, Vancouver Foundation, or there's local foundations, they've been able to get supports from some local centers. But until the federal funds start flowing from federal government to us to the friendship centers, the provinces have announced to a certain extent some Indigenous funding. We don't know if that's going to go to friendship centers yet. Ontario seems to be the only province that has actually committed funds that friendship centers will be able to access. But the work has been happening for the last 6 weeks. 6 weeks, friendship centers have been doing this work without the financial support. And, when people are in need, I don't want to say distinctions don't matter, but when you're in need and you're calling somebody for help, you want that help to show up. We've been doing our best, and I think I'll hand it off to President Shepherd to offer any other components. I hope that answered your question, but it's just trying to express the need that's there and the work that we have been doing for the last 6 weeks and the support that we're trying to get. And I'll just say this last thing is, we've been hearing from a lot of First Nations about the supports for their off reserve, and we've been trying to meet those needs. And a lot of our friendship centers do have good relationships with their local First Nations. And so I think, one of the best problems that we will have is that our people having not just enough, but too much. I don't think that that's going to be a problem. So I think that the more supports that we can get out, the more supports that are available for people, the more options they have to meet their needs can only serve the people on the ground. And so I think we should be doing the best that we can to make sure to coordinate our efforts, to coordinate our resources, to plan, to work together, and to ensure that there are no gaps, that we're not leaving anybody behind. So thank you for that. I'll hand it off to President Shepherd.
Chris, you need to unmute.
Thank you. To echo even what Grand Chief Jerry Daniels said, it isn't enough money, period. So you start at a deficit from the very beginning. And I think for our perspective is to see that envelope of money and to know that you are now competing for 15 million across the country, knowing that you have 100 organizations to try to get resources to on the ground. The fact that there was a structure that was that underfunded and competitive was very, to me, it was disrespectful. You are asking people to say, like, you're kind of indigenous, not indigenous enough to be trusted, to be given resources to support people. So we're just going to make you dig really hard to get the data and to report on it so that you can help people on the ground. The fact that that design even existed in some way, shape, or form tells me that there's a huge problem with how this response has gone for just everyone in the Indigenous space, but especially when it's so obvious that you have a section of individuals who are treated so differently. And we don't know when that money is actually going to reach organizations. You know, there are multiple non-Indigenous not-for-profit agencies and national organizations who did not have to apply for their allocations either, because they're providing essential services or they're providing something that's needed. And I think even when you look at it from that scope, like there's a clear issue with how this is developed and framed, and why is
that?
Thank you, Chris.
Thank you, Mr. Vidal. We go now to Mr. Kellaway. Mr. Kellaway, 6 minutes, please.
Thanks so much, Mr. Chair, and hello, colleagues, and thank you to the witnesses for coming today. Before I begin with my questions, I'd like to acknowledge that I'm speaking to you from Mi'kma'ki, and that's the ancestral unceded territory of the Mi'kmaq people. My first question, I have two. One is an open-ended question to anyone on the panel that would like to answer the question. As we know, COVID-19 can affect anyone, anywhere. We all know that all too well. And emerging research shows us that there are risk factors, that make certain communities in our country especially vulnerable to this coronavirus, as the disease emerges with such speed, such cruelty. Due to consequences of systemic racism, geographic inaccessibility, and historical injustices, many Indigenous communities find themselves especially vulnerable in this pandemic. Can you speak to two measures that you believe the government is doing well, and two in particular that we need to change immediately? That would be very helpful. That would be my first question, Mr. Chair, and that's open to any and everyone on the panel.
Go ahead, whoever would like to answer.
Perhaps I'll start. This is Natanova, TK. We found that there's been a lot of communication, but then also at the same time a lot of confusion. And so the way in which the government of Canada has worked with Inuit in allocating $45 million of the $305 million for the Indigenous Community Support Fund was in line with the Inuit Nunavut policy approach. And then the ITK Board of Directors allocated those funds within the board process. So each of the regions had a specific allocation, and now there are a number of interventions that have already happened. On the other hand, there have been challenges in relation to responsibilities and participation in conversations about healthcare systems and data and personal protective equipment and a number of the essential considerations for the flow of health services in relation to COVID-19. And it would have been great, and it still will be something that we look forward to participating in those conversations, even if we, as Inuit, don't always deliver those services to our communities. Perhaps President Kutuk could talk specifically about what Nunavut has done in relation to the implementation of COVID-19 funds.
Go ahead if you wish.
Thank you for the opportunity. In terms of the resources that were allocated through the federal government in Nunavut, we were very quick to determine how we would allocate those funds across the vast territory. As you know, Nunavut makes up 1/5 of the geography of Canada. And so the Nunavut Tungavik Incorporated board members have been having daily calls to determine how best to allocate that money. And much of that money has already been allocated to provide financial support to elders so they can purchase food items as well as purchase cleaning supplies. We've provided a substantial amount of resources to municipalities so that they can ensure that there's water and sewer delivery on a daily basis. Particularly when there's the public messaging about washing hands, we think it's crucially important that in overcrowded housing situations in Nunavut, which is very common, and we know in this day and age we need at least 3,000 houses just to meet the current housing need across our territory, that the common mentality is to conserve water usage. And we don't want that in a time where we're having a global pandemic. The other area that we've put some resources into is to address food insecurity. In Nunavut, it's astounding already that 7 out of 10 children go to bed hungry each night. And instead of getting better, we know that the statistics recently released have indicated that it is now out of 10 children that go to bed hungry each night. And we know with the experience we have had with, for instance, infectious diseases like tuberculosis, both overcrowded housing circumstances and food insecurity have a big impact on how one is able to fight off infectious diseases. So I think the approach we've been taking is very much focused on meeting the basic needs that, in our view, should be met even before we find ourselves in a global pandemic. And I think this opportunity for us in a global pandemic has been that we've been able to have very open communication, open decision-making amongst Inuit organizations and all government levels, including the territorial public government here in Nunavut, as well as the federal government. And I would say that one of the things that our position is at Nunavut Tungavik Incorporated is that the federal government should invoke the Emergencies Act in Nunavut, because in our view, although we don't have a confirmed COVID-19 case yet, we know that the capacity financially and in terms of human resources is not what it needs to be in our territorial public government. And it's crucial that even before COVID-19. And so I think we need to take a look at it. And I think the very scary, terrifying public health crisis that we are all under right now is an opportunity to highlight the great needs that so many Canadians live under. And I think this is an opportunity that, as members of Parliament, that you're able to take a better look at the social inequities that Canadians face. And I, of course, advocating for Nunavut Inuit would say, please take a look at the social inequities faced by Nunavut Inuit. Thank you.
Thank you very much.
Thank you, Mr. Kilaway. Is there anyone else who would like to respond to Mr. Kilaway's question? Otherwise, we'll go to our next question.
Quickly, I think one of my biggest concerns or things that I think is not being done well right now is the framing and preparation of the disaggregate data that should be collected to really see what does this look like and what was the outcome for Indigenous people across this country. Because if it's not every region collects really good disaggregated Indigenous health data, and it will be really important for us to know like what was the outcome for our people across this country in every jurisdiction. And I know health is a really provincial piece, but I think for the Public Health Agency and Health Canada, it would be really important to make sure that that data is disaggregated so that you could tell that story after the fact.
That's a really great point in terms of the data, the evaluations, and the assessments. So I appreciate that feedback greatly. Thank you.
Thank you, Mike. Grand Chief, I see you leaning forward. Does it mean you wish to respond as well?
Yes, just on the health transformation piece, I think that's been even prior to the COVID-19. I think that's a good thing that the government has done. We've been trying to move as quick as we can, kind of pursuing sort of the BC First Nations Health Authority model, where you have First Nations a lot more hands-on, more involved in the strategy and the planning for the communities. Does that help?
That does, and I would just say very quickly, because I know I'm over my time, is Grand Chief, I'd like to at some point talk to you about your efforts with respect to securing doctors from Cuba and how you're getting along and how can the government help. Thank you.
Thank you, everyone. We go now to nous allons maintenant Monsieur.
We will now move on to Mr. Thériault. Mr. Thériault, you have 6 minutes. Please go ahead.
Oui, merci, Monsieur le Président.
Yes, thank you, Mr. Chair. As people come to testify before the Standing Committee on Health, there is a constant, particularly when it comes to the capacity that we have to fight this pandemic and to limit contagion and its virulent effects. Every living situation that was fragile before the pandemic has become a situation where it is difficult to contain the virulence of this contagion. That's what worries me when I hear about the lack of resources that today's testimonies have highlighted. We know that in Quebec, 55% of Indigenous people who are part of First Nations who are living in urban areas are living in situations that are concerning. For the Department of Indigenous Services, I have a few quick questions for you. I'll ask them all, and I would imagine I will be getting equally brief responses. First of all, to counter a pandemic effectively, we need an exact idea of the situation. If I look at Nunavut's territory, my concern is, do we have an adequate testing capacity? Did we send testing kits quickly? For remote regions, that's important, especially because we know we have to isolate people who are infected. Before the pandemic even happened, over 20% of Indigenous persons experienced housing problems, including overcrowding. Did we send tests out? Do we have an adequate isolation plan? We sent rangers to Nunavik. I don't know if they've arrived already, but I would like to know what their role is exactly, how they're going to be deployed, what is their mission. And when it comes to health staff, we know that we have to flatten the curve to ensure that the capacity of the system can take care of people who need intensive care. Do we have everything we need on all of our territories to respond in terms of human resources, doctors, equipment, in order to save people who are seriously affected by this illness?
Donc, je pourrais répondre.
I could answer some bits of the question, and then I will give the floor to Dr. Wong to see if he has other information to add, or perhaps even Mr. Obed would have some information to share when it comes to Nunavik. Nunavik is part of the provincial system. We're not funding regional administration directly when it comes to healthcare services. They're integrated as part of Quebec's system. They do share information with us as needed. If we need additional resources or equipment, they can come see us, and representatives did come see us when we needed personal protective equipment. Based on our inventory, when Quebec had a significant increase of COVID-19 cases, we were able to provide some supplies. There were worries that equipment would not be received quickly. The province came to see us, and we were able to meet their needs. The reason I provide this context is because we're not as well integrated in their daily activities because they're part of the provincial system. But I can say that when it comes to requests for rangers, I'm not sure how to say that in French exactly, I know that they are there to help with logistics when it comes to infrastructure. That means additional infrastructure is going to be set up. Sometimes there's infrastructure that exists already but needs to be reappropriated. Therefore, they will participate in disinfection measures, ensure that supplies are provided. That way, infrastructure can be repurposed, either for isolating members of the community or also to house individuals who are providing services and who are part of the additional capacity required to respond during this pandemic. When it comes to your question, what we did in communities and First Nations communities is that we made a lot of purchases of temporary structures that could be quickly mobilized by communities. We already have 78 different infrastructures that are already present to meet additional needs, especially in small communities or more isolated communities. When it comes to intensive care capacities, those services are provided in hospitals throughout the country. We only have 2 hospitals under our responsibility in northern Manitoba. And so we're working with them more closely. But I can tell you that when it comes to working with provincial governments to ensure that there's planning for increased capacity for intensive care and being able to receive patients from isolated First Nations communities, we're working very closely with them to make sure that those plans are in place and that we will be able to evacuate members of First Nations communities quickly, early, before they become very ill, to not wait to a certain point where they become critical. Have them close to a hospital or bring them into a hospital as soon as complications develop due to COVID-19. That's a partial answer. I will just ask Dr. Wong if there's additional information to share when it comes to Nunavik. Dr. Wong?
Excusez-moi, Nunavik et...
I'm sorry. Nunavik, in general, has an overpopulation problem. Pardon me?
Monsieur le Président?
Pardon, Mr. Chair?
Your time is over.
Ah, okay.
I'll let Dr. Wong respond to your question if he has something to say.
Thank you. OK, merci. Pour le gouvernement du Canada, dans le domaine...
For the Government of Canada, when it comes to public health, we've granted priority to sending test kits to remote communities. The Spartan Company, which is producing the Canadian version of the test, does not have the test boxes. They're currently in production.
3 semaines, la compagnie...
In about 2 or 3 weeks, the company will be able to produce enough testing kits, and we are very pleased to see that in 2 or 3 weeks, we'll have enough product for remote regions. Thank you.
Thank you. We go now to Ms. Ashton. Ms. Ashton, please go ahead. 6 minutes, please.
Thank you very much, Mr. Chair, and welcome to all of the witnesses here today.
Est-ce que tu pourrais aller tasser la boîte, faire de quoi?
I'd like to, first of all, register a number of key concerns that my colleagues and I share with respect to what Indigenous communities are going through. Very concerned, including in today's meeting, around the absolute lack of funding available to off-reserve Indigenous peoples. The fact that there is a deadline, there was a deadline connected to this funding, and this is an area that needs to be dealt with urgently, recognizing how vulnerable Indigenous urban communities are. I do want to spend the next few moments asking questions of Grand Chief Daniels as well as President Obed, but certainly would like to bring in the focus around urban Indigenous communities at some point as well. Obviously, we're very limited in our time here, and I, like many, hope that we can have a virtual parliament so that we can raise these issues at all levels with the urgency that they require. So first to Grand Chief Daniels, thank you for your powerful presentation. You've talked about the huge inequalities that First Nations in your region struggle with on a daily basis. I'm wondering if you could talk a bit about announcements that you've already made or calls you've already made around the need for Cuban doctors. Why is it that SCO First Nations are making that call? I'm also wondering if you could talk a bit about the need around federal funding for infrastructure in communities, whether that's repurposing spaces right now to create temporary housing, whether it's building a ventilation center like Barons River has proposed for its area and the surrounding communities, or whether it's some communities as well, including further north, have talked about the need for military hospitals. Should there be direct federal funding for infrastructure at this time? And finally, if you can speak to the need for personal protective equipment, not just for healthcare staff, but for frontline staff that work for First Nations. So if you could reflect on some of those key messages. Thank you, Grand Chief.
Thank you, Nikki, Ms. Ashton. I just would like to state on the question around the Cuban doctors. We took a tour to Cuba, and we had asked to have a contingent or a brigade come here to Manitoba. And part of that, the reasoning behind that was because we seen a crisis first that was coming, and we'd already been working to have this happen prior to the pandemic getting to the point to where it is. But we wanted to see the kind of impact that it could have, because what we see in our communities is a lack of services on the ground. We haven't had long-term people in the community. We have a rotating kind of nurses coming into some of our isolated communities. And so we wanted to have long-term consistent service being provided. And what we saw was the World Health Organization giving a great deal of notoriety to the Cuban health system. And so that's what we wanted to see, if the return on investment would be significant. And we wanted to see what kind of return on that investment we would get if we were to put it side by side to what we're seeing with the current health outcomes and the current strategy. So that was kind of the reasoning. There's not a great deal of resources. We understand that, and so if we can get better health outcomes through this process, then perhaps that's something that we should consider expanding. So that was kind of the point with Cuba, and we're continuing obviously to try to have doctors come into our communities, maybe help with the health transformation side of things, maybe have some of our people trained at their International Health Institute over there. So we toured the facility. That was our point there. Better return on investment. If we could see that that's a reality and that's a measured investment that could work, then we would like to go there. Second, many of our communities have actually, what they're doing is rather than having people go into the urban centers and purchasing goods, they're actually buying bulk. And some of the communities are disinfecting the merchandise that comes into community, and then they package them into kind of care packages. So they break open the shipments, and then they break them down into smaller packages. And at that point, they were running. They didn't have PPE equipment, and so what we were wanting was our communities, the people who were doing this, to have that, so that they could kind of screen out any potential bacteria that might have been coming into the community. So that's there's examples of that in many of our communities, including Wayway and others. Quite a few, actually. And so that's what they've been doing in the communities is bulk buying. Many of the communities have also been doing that in the urban centers in Winnipeg here. Many of the tribal councils have been involved in that. And so that's kind of what we're looking at, how to best utilize the limited resources that we have, and while protecting our people. And many of our people, those people who are doing the receiving of food and other stuff and protective equipment, that's what they've been doing. So we've been hoping to support them more. And I know that it was about 3 weeks when there was nothing there for them. So there was a bit of a risk happening. Thank God in Manitoba we've done a very good job in flattening the curve, and hopefully it continues to see zero amount of new infections.
Mm-hmm. Thank you, Grand Chief. Quickly to President Obed, I'm wondering what you could share with this committee about, what you need to see in your territory, from the federal government to support elders, anybody who's over 60 years old, who we know is especially vulnerable to COVID-19.
Thank you, Nikki. I think just from a structural standpoint, an Inuit Nunangat policy approach should be employed anytime the federal government is considering specific interventions for our communities. And that means not leaving behind Nunatsiavut and Nunavik in a northern policy approach, because that's really the way in which a lot of these interventions are structured, north of 60, south of 60. We are a very considerable part of this country, and our policy space should be contiguous from all Inuit regions, and then also the urban components as well. And once you get into then the specific considerations for our most vulnerable, we have Inuit in long care facilities in the south because of a lack of care facilities in Inuit Nunangat. We have a large number of urban Inuit in the south that require very specific considerations and sometimes fall through the cracks. Luckily, we have our land claim organizations that are specifically considering the needs of elders in this point in time. So there have been either direct payments or vouchers that have been given to them so that they can have food. And when it comes to the functioning of the health system, the near-term care and the ability to act quickly in response is going to save lives. And even if we don't have the numbers today, that specific consideration of getting point of care testing to our most vulnerable and then being able to treat Inuit where they live rather than shipping Inuit south is also going to save lives.
Thank you, Ms. Ashton. That concludes round one. We will start now round two. I'm going to be a little bit more ruthless in our timing going forward. Please go ahead, Dr. Kitchen, 5 minutes.
Thank you, Mr. Chair. And yes, you'd always be ruthless when I come on. Thank you, everybody, for being here. I appreciate that and your opportunity for you to speak to us. I noticed as of yesterday that 53 First Nations and 13 Inuit have been tested positive for the COVID virus. And I hope and I pray that we will not see any more of those. The one thing that we haven't been told is how many of those have recovered, and I'd love to see that information to know how many of those actually have recovered. My first question is to is to Ms. Gideon, and then that's on your website. You state that the ISC maintains a stockpile of personal protective equipment, PPE, and hand sanitizers in the event of a health emergency in First Nations on reserve communities. Can you tell us how many masks, gowns, gowns, gloves are in that stockpile? And if you can't, can you provide that for us today? Can you provide that information to the committee?
Thank you very much. I don't know if Dr. Wong has the numbers in front of him handy. Otherwise, we can certainly share that information with you subsequently. Dr. Wong?
Just to actually give you, an idea, in addition to, our stockpile currently, for example, with the gowns, we have over 1 million gowns, in, our stockpile, and close to 1 million, gloves in our stockpile. So we have, at this moment, more than 300,000 N95 in our stockpile. So those are just, some examples. In addition to that, every time Canada receives another new shipment, some of the part of that shipment goes to the Public Health Agency, the national stockpile, and for Indigenous services in order to offer the PPEs for First Nations on reserve. We have access to that stockpile as well.
Appreciate that. So how much of that stockpile is being distributed to our First Nations?
Since January, just to give you, a magnitude of scale, for example, for gowns, approximately about 160,000, gowns have been distributed. For gloves, approximately just under 500,000 gloves has been, distributed. For surgical masks, close to 200,000 has been distributed. And for N95, that's used for aerosol generating procedures, close to 90,000 of those N95 have been actually distributed. Thanks.
Appreciate that. Thank you very much. Are there any First Nations that are still waiting for a supply of PPE?
Every day, we get requests. So as of yesterday, for example, 570 requests have been shipped out of the warehouse, and on an average day, depends on a number of requests coming in. We operate 7 days a week. Approximately about maybe 20 to 30 requests are waiting to be processed. Some days are smaller and some days are bigger, depends on the number of requests coming in. So
thank you very much, Doctor. Appreciate that. As we know, after the H1N1 pandemic in 2009, many of our First Nations in Canada, such as, in my riding, Carry the Kettle Nakota First Nation, the Cowessess First Nation, the White Bear First Nation, and they've all taken positive steps in setting up and monitoring stations around at their entrances. And I know this is going on across the country. In fact, I've been led to believe that about 376 communities have actually done that. And I guess developing this emergency response plan and protocol in the event of future pandemic is important for them to do. So my first question, I guess, to you, Grand Chief, would be, what are your thoughts with respect to creating a coordinated emergency response plan for all First Nations across Canada while continuing to respect your individual jurisdictions?
Well, I think theoretically it works. Practically, I'm not sure how that works. There's problems, I think, when you start getting into the different regions on coordination. Communication is always a big factor in those kinds of scenarios. I mean, in any national strategy, there's always going to be regional demographic differences. And how do you communicate effectively between the national level and the regional level, which may have a better understanding of what's required and have better communication? What we found is if you have it more regionalized, I know that the larger strategy is important, but you can have large strategies that are in the region, and I think that's where you have to build it off of, and that's the best way forward. And it's because you just can't connect at the same level at from a national perspective. You just can't connect locally as much as a more regional body would. And so that's what we've done. We've been connecting very closely with the communities. We have people in the communities that work with our organization, and so what we found is that we're received better. Our communication lines are better, and we continue to get a great deal of confidence from the community in our organization. And so we think the same thing with any health strategy.
Great. And Chief, Grant,
thank you, Doctor.
Thank you very much, Grand Chief.
Yeah. We go now to Dr. Pulaski. Dr. Pulaski, 5 minutes, please.
I'm the Member of Parliament for Thunder Bay Rainy River, and I'm happy to acknowledge the traditional territory of Fort William First Nations. And Chief Collins, I hope you're watching. So now I think some of you may know that Thunder Bay probably has, I think, the largest by proportion urban Indigenous community. And so my questions go to the friendship centers. And given the fact that we know that the more expected lifespan of people from Indigenous communities is significantly less than people from non-Indigenous communities, and given the concerns about having the resources to deal with urban Indigenous populations, I know one of the concerns from people in my riding and someone who worked with youth at risk in the Indigenous community was the concern that because we were trying to use social distancing, they were unable to bring together at-risk youth in order to have counseling. And this was a real concern. As he rightly pointed out, these are youth who probably have a far higher risk of dying because of suicide or violence than they have a risk of dying because of COVID-19. And now we're really asking them a bit to pay the price for protecting the elders in all of our communities. So what can we do in order to ensure that we continue to provide services for that kind of at-risk population? What can we do together? I know, and one of the big things you're going to say is money, and I think our party and we realize that $15 million isn't enough, and that's just a start. But besides money, what can the friendship centers and the government do in order to address the risks of that vulnerable population?
Well, thank you for my favorite questions to ever get is about Indigenous young people. On my screen in front of me, there are at least 3 of us who were youth council members of our National Youth Council, actually. The one thing Canada can do is right now in this country, there is no Indigenous youth specific program to support their identity, their culture, to create leaders. There is nothing. The fastest growing demographic in this country does not have a specific program for it. Canada's literal future economy is based off a population that has the least amount of support of any demographic. And yet we ask what we can do for a population that has the highest rates of suicide, the highest rates of self-harm, the lowest education attainment, the highest rates of incarceration. And that's a fact. You have no program that is specifically designed for Indigenous young people.
Okay.
Other than that, I don't know what else to say.
Yeah, and if I can just add quickly, if I could just add quickly what we've been hearing from the friendship centers, there's a few things. So a lot of the friendship centers are trying to provide supports for youth who are in foster care or youth in care, because sometimes the friendship center is like the connection to their culture and their community in the urban spaces. So we've heard some friendship centers are doing the best that they can to do special outreach to those young people. We are also calling for some technology, so software, hardware, tablets, laptops, cell phones, so that the Friendship Center staff can move to a virtual service provision instead of working out of an office, that they're able to connect, and that they also want to be able to donate or to lend these devices to the community members so that they can stay in touch. So not just for young people who can like keep in touch with their counselor at the Friendship Center, but also for other vulnerable members of the community, like seniors, Indigenous seniors, to like the isolation is like also affecting their mental health and they're not able to connect as well. And a lot of Friendship Centers have transitioned their programming to be able to be accessed virtually. So they've been doing a lot of youth-specific outreach to keep young people connected to each other and trying to find new ways to connect. And so I'll just add on there the connectivity issue, ensuring that internet is widely available, especially in the rural and remote and northern communities, so that they can actually tune in to some of the programming and have access to what content is being developed that is helping them stay connected. And then also it's not just having the internet available, but being able to pay for that internet at home so that we don't have young people who have to drive out to parking lots or have to walk out to parking lots and huddle under a blanket so that they can do their homework or that they can like connect to what's happening so that they actually have access to all of these virtually provided services. Thank you.
Okay, Ms. Forisma, you did mention
Marcus, your time is up. I believe. I think Grand Chief Daniels had a response, or did I misunderstand?
Well, I mean, we can comment. I mean, it's important that mentorship is a cornerstone of helping our young people pass on the values and the teachings of our people. I was obviously benefit a great deal from many of my elders, many of my elder cousins, and people actually within the Friendship Center movement who helped mentor me. And so I think that when we think about young people, it really is about a mentorship, supporting one another. And in this case, if you had a national strategy, it was one of the things why when I was first elected Grand Chief, we created a youth council here. We gave the youth a vote here. We worked very hard to try to mentor our young people. We go out of our way. We had drum practice here. A lot of that was interrupted by the COVID-19 pandemic. You know, we were out on the road taking action, running, raising money for diabetes prevention. There was all kinds of actions that we were taking. And I think that that's an important part of creating better outcomes and better quality of life for our young people, creating as much opportunity as we possibly can.
Thank you. We go now to Ms. Jansen. Ms. Jansen, 5 minutes, please.
Yes, first I want to say thank you very much to all the witnesses. It's been very eye-opening. Very much appreciate all of your testimony. I was reading a newspaper article from CBC that had said that some members of the military were being deployed to predominantly Indigenous Northern fly-in communities, and it said that they would be making clean drinking water available. And I was wondering, Ms. Gideon, is it that easy? Do we have to have COVID-19 to get clean drinking water to those communities?
So I apologize, I don't have any specific information about any requests for assistance relating to drinking water, but our department wouldn't see all of the requests for assistance necessarily. That would be submitted through provincial or territorial governments. So I do apologize that I do not have the specifics on that front, but I would say to you, though, that having surge water infrastructure and capacity is something that communities are submitting requests to our department for as part of the COVID-19
Sorry, I have a really short time. Sorry, my apologies. So I have a question for Jocelyn Formsma. And it was actually also in regards to water. I had seen a photo of bottled water, 24 bottles of water for like $100. And I hear that a bag of flour is for $100 as well up there. And I'm just wondering, is that normal? Is that normal cost up there? Can you speak to that, Ms. Formsma?
Sorry, are you referring to costs in the territories? I might not be the best person.
Okay.
Yeah, I might not be, like, we're looking at Friendship Centers all across, perhaps in, like, you know, the Northern Territories, that might be the case, but perhaps the folks from ITK might be able to better speak to those matters.
Well, maybe I can actually ask you in regards to
Ms. Jansen, your mic is a little too high apparently. Maybe you could put it down so they can hear you better.
Sorry, I was drinking coffee. So what I was wondering then in regards to overcrowding, I think that was another thing that you've mentioned, how how is it that in the homes that are overcrowded, how do we do social distancing? Or have you been familiar with how that has been able to be carried out? Or perhaps Grand Chief?
Yeah, I could actually answer that. In Barron's River, actually, they've been working on creating a camp for isolation, and so that's what the council has been communicating to me. But just on the topic of water infrastructure, I know we've had huge problems with the water infrastructure process, and I think that there's a very big conflict happening within the regional office on this. Just at we've had examples of where the cost of the infrastructure that was developed were almost $2 million over what they could have utilized. And Skowhegan is an example of this, where just down the road in Waterhen, they had a water treatment plant that was award-winning, that took water from the lake, where the one in Skowhegan, they took water from the ground because it was a state-of-art membrane system, $2 million more, and to this day still doesn't work.
Wow.
And so that's a clear example of where the regional office has failed when it comes to providing water for our communities.
Right. And then a quick question in regards to getting information out. I know that Ms. Gideon talked a lot about getting information out in regards to COVID-19 and so forth. But it's my understanding, like even just the cost for data, as I think it was one of the previous witnesses were talking about, is hardly affordable. How exactly do we get that information out to everybody at those kinds of costs? Also, maybe Chief, I don't know who could speak to that.
I can say that we are funding communications activities when First Nations organizations have submitted requests, for instance, for communications campaigns or outreach. We have funded those.
Grand Chief, is that money getting out to the further out areas?
Could you ask a question?
Is that money that she's talking about for data and for making sure that people can actually access the online information? Is that getting out to the rural and the remote areas?
I think that it is to an extent. I know that many of the communities are online. There's calls every day here in the region, so there is some back and forth happening. So
okay. And Ms. Formsma, I think you mentioned that there are many young people that have a hard time getting that data, the online availability.
We've been working, we've been trying to make sure that the information is getting out. NEFC is actually partnering with the Well Living House to ensure that urban specific information is getting out. But we've also been working with Indigenous services. So with Dr. Valerie Gideon, we're about to embark on some urban specific messaging and communications. We recognize that a lot of it is on reserve specific. And so instead of just, complaining about it, we've offered to work with the department to ensure that that communication is available, and we want to make sure it's getting out as far as possible using our network. Right. So that's what we're doing.
And do they have boots on the ground in the?
Thank you. We go now to Ms. Sadhu. Ms. Sadhu, 5 minutes, please.
Okay. Thank you all for joining us today. I want to recognize, even though I'm joining from my home, I would like to begin by acknowledging and that the land which I'm sitting on, we gather, is the traditional territory of the Haudenosaunee and Anishinaabeg. It has been mentioned. My questions to our Grand Chief Daniel. Today, up to 80%, you mentioned about diabetes prevalence. Today, up to 80% of Indigenous youth will be diagnosed with the diabetes in their lifetime. Could you go into the detail how this time when we are in this situation, especially dire with the epidemic, especially people are mostly or more vulnerable with the heart disease, diabetes, how we are handling those population?
Well, I think long term, we need to focus on food security and actually creating gardens in the community gardens, year-long gardens. And we see examples of this in OCN, where they have all year, they're producing their own vegetation, their own produce. and then they're providing it to the community. So we need to see this expanded. I think that the education system should shift towards these kinds of things. We really need to focus on priorities around what do young people really need? What are the tools that they need? What are the skills that they really need to learn? And skills on survival, on food security, those kinds of things should be of the highest importance. And so when we think of the education system, when we think of employment and training, we got to think about those kinds of things. Micro strategies, micro sustainability. Those are the kinds of thinking that we need to be focused on. And I would encourage all sectors of government to think that way when you're thinking of First Nations, because First Nations can't be just reliant on these big aggregates all the time. There really needs to be a localized strategy, and I think that's the best way forward.
And on the last meeting, Canadian Mental Health Association were testified, and you mentioned about your youth council and guidance from elders as well. How can the federal government better support mental health for the Indigenous population? Can you elaborate on that? And I also want to ask the National Association for Friendship Center if you can elaborate on that too.
Well, we've asked for mental health to be expanded in the region. We have 2 facilities here in our region, and we're looking to expand that. Great deal of work needs to be done in this area, and I think that the national suicide prevention strategy that was implemented way back in the day yielded a great deal of results, and the friendship centers were involved in that, and so were a lot of other Indigenous organizations. And we want to see continued focus on our young people, providing support so that we're not involved in the kind of numbers that we're seeing right now. We need to see a change in the number of people who are feeling like they're hopeless, and that takes a combined strategy with a lot of different partners. A lot of it has to do with the institutions that govern and some of the interactions with Indigenous people feeling systemically discriminated against, and it's in every institution that we can possibly look at, and there's examples of that we can point to. But I think that you need to create the facilities. You need to make space for that. You need to have a strategy that has, you have the facilities, but also in the community, and supporting positive livelihoods in the schools, all those areas. But I think that mentorship is key on this. People need to feel supported. Young people need to feel supported and feel loved. And it's unfortunate the history that has got us to this place. But I think that there's an opportunity now for us to create that change.
BC First Nation has a program like the Virtual Doctor. I know Virtual Doctor for the Day program. Do you think this type of program is the benefit for the remote communities because it's too far? Like Indigenous population it can be helpful for those that type of areas.
Sorry, it wasn't clear who that was directed to. I was going to respond on the mental health thing, but I'll leave it to the chair.
Okay. Mr. Chair, do I have a more time?
Your time is up, but there's a little confusion about who's going to respond to that. Was that directed to Grand Chief Daniels?
Yes, our National Association of Friendship Centers, if they can, answer just a short.
Yeah, if we could get a quick answer, please.
Sure. Just quickly on the mental health, that's been our National Youth Council has also identified that as a priority for youth across Canada. I would just say for healthcare in general, but especially for mental health care, availability within the urban spaces doesn't always mean access for Indigenous people, because it's the culturally safe environments that really foster well-being within our communities. So when it comes to mental health, there's a lot of I think there's there's availability of mental health, whether it's accessible and whether it's something that Indigenous people feel safe, and especially Indigenous young people feel safe accessing. That's another question. So I think, you know, if somebody is actually getting to the point where they can actually reach out and say, I need help, when they make that call or when they do that outreach, there definitely needs to be something responding, or somebody responding back saying, yes, I can help you, not, sorry, you need to call this number, or sorry, you need to call that number. And you get that 2 or 3 times when you're in a state of mental crisis. That can be very discouraging for somebody. So I guess just to make sure that if those services are available, that they're also accessible, and that if a person says, or if a young person says, hi, I'm a child of a 60 scoop survivor, and my great grandfather or my grandfather went to residential school, and if that counselor doesn't know what that person is talking about, then you're in a position where you have to educate the person that's supposed to be helping you out of that crisis, right? And so that adds an additional burden. So I'll just leave that for now on the mental health piece.
Thank you. We'll go now. Nous allons maintenant à Monsieur Thériault encore.
We're now moving back to Mr. Thériault. Mr. Thériault, you have 5 minutes, or 2.5 minutes rather. Please go ahead.
Oui, merci, Monsieur.
Yes, thank you, Mr. Chair. Everywhere on the planet where COVID-19 is present, we are starting to see that isolation has 3 negative effects on mental health, on addiction, on family and domestic violence. My question is for the National Association of Friendship Centers, and perhaps also to Grand Chief Jerry Daniels. Could you tell us if your associations or organizations and the organizations that you're in contact with have also observed an increase of these negative effects since the beginning of the pandemic? And I would like to know, because prevention's important, what do you need to effectively and adequately counter these types of negative effects? What would be the solutions you would put forward?
Jocelyn can probably follow up more specifically about examples from specific centers. But I think really it's about understanding the isolation that already exists in urban spaces, because it's, as Jocelyn said, there's this idea that because you live in a city, it must be better. You have access to counselors or services or programs, but in reality, it is sometimes even more isolating because you don't always have those same kinship bonds as you would in your own territory. And so I think recognizing that people are more than just, say, a clinical response. They require an emotional response, a clinical response, and sometimes just a social response or an opportunity. And so when you have an urban person who may not have a phone, who may not have the internet at home, who may live in a boarding house, for example, all those factors contribute to someone's isolation. And the building up of some of these other social issues, because there really isn't a strategy for dealing with some of these interpersonal stressors. And now, if you don't have a virtual way to, say, meet with a counselor, you're alone. And for a lot of these issues, that isolation makes it even worse. So I think understanding that the connections and connectivity that need to exist in communities to make sure people are wrapped around the services they need. You know, eligibility, I'll learn to say that one day, within even across government programs. Like there are federal programs where technology is not an eligible expense. And so you have to start looking at how do you really support the most vulnerable? And it's the flexibility to get the tools that you need to be as connected and supported as possible. I'll let Jocelyn, because I know she has some specific data about what we've seen since the start.
I'll just add quickly.
If you could do it in like 15 seconds.
Very short. The only thing that I want to add is that we are hearing that the workers and the volunteers at the Friendship Center are also experiencing great mental health strain for not feeling like they're doing enough and not feeling like they're meeting enough of the community's needs. So we've been trying to figure out how do we support the frontline workers in dealing with the mental health in addition to the community members. So that's all I'll add. Thank you.
Great, thank you. Merci, Monsieur Thériault. We go now to Ms. Ashton. Ms. Ashton, 2.5 minutes, please.
Thank you, Mr. Chair. Just quickly building on what you've been saying, I was wondering if President Shepherd-Boyd, if you could tell us, just perhaps to reiterate, how insulting is the lack of funding for urban Indigenous communities, as well as the imposition of a deadline on the grants that were being made available? Does this need to change now?
I just think that for what Friendship Centers have contributed to Canadian society and what it does every day, I want to start seeing that recognition and that trust instead of hearing about it. You know, we hear a lot that Friendship Centers do great work. You support people every day. We do millions of client contacts a year with 3,600 employees, but you have 7 days to prepare a national proposal to support your organizations on the ground when we have people chasing down commercial sanitation trucks to get enough supplies to keep their homeless shelter sanitized. And then you're told you can write a proposal and have your measurements and your data collection strategy in place. As someone who used to be an executive director of a Friendship Center, we couldn't expect our organizations to do it. And I felt bad for other urban organizations who may not have had the capacity.
Mm-hmm. Thank you. And just quickly, President Obed, Grand Chief Daniels, we heard about the urgent need for food security, and there was mention, Grand Chief Daniels, to the lack of access to baby formula in Little Grand Rapids. Should the federal government be stepping in to make sure that whether it's diapers, baby formula, healthy foods are made available now to fly-in communities?
Perhaps I'll start. Absolutely, and there have been announcements, top-ups to Nutrition North, expansion of specific items, but there's a larger issue of food insecurity and poverty that has to be addressed in the long term. Also, that on a day-to-day basis, we don't know where the COVID-19 response is going. We don't have a full understanding of all the effects on our vulnerable communities in relation to food insecurity. And so next month, we may need something very different than what we needed today. And so to have that in the front of minds of people is that people are already hungry and that our response has not been enough just systemically. So at this time, we need even more.
Food security needs to be addressed right away. There can't be any back and forth. Oh, it's the province's jurisdiction. The federal government is responsible for Indigenous peoples, period. And so you need to make sure that those kinds of things are being provided for our communities and our community members.
Thank you, Ms. Ashton. That concludes our second round of questions. We start now our third round. We start with Mr. General. Mr. General, please go ahead, 5 minutes.
Thank you, Mr. Chair, and good to see everybody again this week. I'm going to split my time if there's some available, Mr. Chair, with MP Vidal. Just the one question I just kind of want to get out there is on testing, and if someone's able to answer, it would be great. How available are tests on reserve? Where are people getting the tests done? And are temporary hospitals being established in communities, or are they being considered? Thanks.
I will ask Dr. Wong to start with the question, and I may supplement if there's time. Dr. Wong?
Thank you for the question. Currently, on reserve, all First Nations on reserve in our nursing stations, there are swabs and nurses available to actually take a sample from the nose and send them off to the provincial laboratory system. As we know, in each province, there's guidelines, on, the criteria for testing, and we follow the guidelines, of the province where the particular reserve is, in. In addition to, acknowledging that there's a lag time, both in transporting the swab to an urban center where the lab, the provincial lab, is situated, and also, as you have heard, depends on the province. Some provinces have longer wait time and turnaround time, for the results to actually, get back. One of the latest development, is the approval by the regulators here in Canada, by Health Canada, of two rapid point of care test kits. One is produced in the United States. The other is produced in Canada. Those two test kits have the potential of bringing the testing much closer to the community. For the U.S. Test, unfortunately, currently, because of the difficulty in getting some of the test equipment and test kits out of the United States, therefore, they are slow coming into Canada. Those test kits and those equipment that's produced in the United States are being placed in hospital labs. Whereas the Canadian product that's produced in Canada that recently got approved, currently the product is not available other than for beta testing, for pilot testing in the laboratory by provincial laboratory system and by the National Microbiology Lab. The reason being is that when we ask the company is saying that they have to internally ramp up their production schedule in order to come up, with the test machines as well as those test cartridges. And they are hoping that in a couple of weeks' time, that they would, be able to have some boxes of those equipment and cartridges for testing. But in the meantime, over the next week or two, all they have is some very, very small number of test equipment and test kits for provincial laboratories and for national laboratory to actually validate the testing. And after that, then, at that point, they can actually be able to actually ramp up the testing so that, the test kits can actually be going to all over Canada. However, even at that time, they're expecting that in the beginning, they will have a small supply, and then the supply will increase over the courses of the coming weeks and months. So thank you.
On the field hospital side, or the expanded, what we're doing now is in remote and isolated communities, we have pre-positioned some mobile temporary structures that can be deployed, flown into a community setting, that can provide extra space for testing purposes or assessing individuals. It's not intensive care units, right? The idea is that individuals would be able to be tested, assessed, and then as needed would be transported out of the community, where they would be brought closer or in a hospital system to ensure that they're properly treated as might be required.
Thank you. This is MP Vidal now. My question is for Ms. Gideon as well. In the application process that's been talked about much today on the urban side, there's obviously some concern being expressed with that. Can you tell us who was at the table making the decision on how to allocate that money and what was the criteria used?
So we did have representatives within the department with expertise in terms of social programs that led the coordination and the assessment of the proposals very, very quickly. Those recommendations were then brought to our deputy minister and will be brought to our minister. And we expect within days for decisions to be able to be finalized.
Thank you, Mr. Vidal. Thank you, Mr. General. We go now to Mr. Van Bynen. Mr. Van Bynen, 5 minutes.
Thank you, Mr. Chair. This question is for Dr. Wong and Ms. Gideon. On April the 10th, there was a technical briefing with the Minister Miller and yourselves, in which the fact that First Nations and Inuit communities were susceptible to COVID-19 because of housing overcrowding, which can make it difficult for people to self-isolate. And since the briefing, have different communities found potential solutions for this issue so that individuals testing positive for COVID-19 can self-isolate safely? And what roles does the ISC play in this?
Absolutely, I can speak to that. So communities have looked at various options. Some are actually renting hotel rooms that are nearby or in community, and we are helping them to pay for that. Some of them have repurposed other facilities that they have in the community in order to create those spaces. And some have actually purchased, or we have purchased for them, ready to move trailers that offer individual spaces. The World Health Organization has also issued guidelines for preparing such spaces based on public health expertise to ensure that they are safe and protect individuals that are within them. So we are working community by community, or in some cases tribal councils, or assisting communities with respect to identifying what their space requirements are.
Thank you. Now, I'd heard that the department was looking into tents to be used as temporary shelters for healthcare provisions, but I'm hoping that you can tell us, A, are they still being considered as an option? And if so, in what capacity will they be used? And if not, what were the deciding factors on that conclusion?
Yeah, so these are mobile structures. I think they are very self-contained, and they would be used for medical assessments, testing, stabilization of patients. We have purchased a number of them directly, and we have also worked with a First Nation partner in Saskatchewan to purchase some for the pre-positioning in Saskatchewan and Alberta. We're pre-positioning some in Manitoba and Ontario as well, and they can be flown in and deployed as required. So those are the purposes, and we've done that. We have about 47 so far that we've secured.
Okay, thank you. My next question goes out to the community leaders. So in addition to the challenges posed by the current housing conditions in the Indigenous communities, what other issues relating to preventing and stopping the spread of COVID-19 within these communities have been brought to your attention, and what is currently being done to address those issues? I'll start with the Grand Chief.
Well, just kind of to reiterate, every community is doing different things. Many of our communities have just shut down their border. And I think that this has been a good strategy in that if your community is isolated, maybe the community can still be a community and still kind of take some community events if that's the case, if you can keep it out that way. So I think that's part of, that's a good thing in terms of the mental health aspect to all of this. If we can isolate it from our communities, then maybe our communities can still function in the way that we were. And not be technically isolated from each other. So there's that. The other thing that I think that needs to be done is that we need to have more involvement, I think, of the healthcare system when it comes to communicating who, when, and where people are being confirmed positive. And so that was the biggest concern, I think, for many of our communities is if we have a community member who's sick, we would like to know. We don't need to know who it is, but we would like to know if it's from one of our communities. So that's kind of been an ongoing thing. Thankfully, we haven't gotten to that point, but how fast that happens is probably what we're most concerned about. Is should that occur, we would like to know immediately so that we can respond properly. So that if you're not isolating quick enough, it's not going to work. It doesn't matter how many isolation areas you have. If it's not done fast enough, it's just not going to work. So that's I guess their biggest concern.
Okay, I'd like to go back to an earlier statement you made, is that you'd like to rebuild the healthcare system. And frankly, I'm glad to see that you're making a bold statement like that. But more importantly, it's important for me to hear that you're doing something about it. So your initiative to go down to Cuba to find other solutions is really reassuring. And we've heard of all of the money that's being made available, and I'm not going to recite those numbers, but I've heard that it's not enough. And I understand that, and I've also heard that it's just the beginning. But what concerns me is the discussion about how the decisions are made and how the distribution of funds doesn't appear to be equitable in some cases. So my question is there a more equitable way or a more responsive or a more efficient and accountable way that you'd recommend be considered in the distribution or the funding of any of the programs that relate to your community?
Chief Daniels, if you could try and make it short, please.
Simple. The demographics themselves. We're 5% of the population. 4 or 5% of the allocation should be for Indigenous communities. Simple as that. And we're the closest to the ground. We're the political representative here in the region, and we respond very effectively to our communities. And we've done our best to have their buy-in. And what we're seeing is that they are bought in. They're bought into having a Cuban model. Cuban doctors in our communities. Let's see what kind of impact that has. If we see an increase in health outcomes as a result because we're taking preventative action rather than providing a solution after or providing a response later, then we're going to get a better return on investment. And I think that's what everybody wants. Everybody wants the best use of our resources. So let's look at examples that people are saying work around the world.
Thank you.
Thank you, Mr. Van Bynen. We go down to Mr. Vidal. Mr. Vidal, please go ahead. 5 minutes.
Thank you, Mr. Chair. I want to follow up with Ms. Gideon a little bit on the question I started before. I don't think you really identified maybe what the criteria was used. So if you would maybe clarify a little bit on the criteria that was used for that. And then also there's been some talk about maybe saying that this 15 million is just the beginning. Would it be your expectation that the application process would be used again for any future funding for urban Indigenous people, and would the same criteria be used to distribute that?
So in terms of criteria, I think there was some parameters that were laid out in terms of the RFP itself, which essentially set the stage in terms of addressing unmet needs, areas where there were no other support systems that were available to organizations. Specific needs that had emerged as a result of the COVID-19 situation. I mean, there was absolutely an effort to be as inclusive as possible with understanding the number of organizations that had submitted requests and to try to balance those needs both geographically and across the different service delivery areas. And in terms of, and included things like mental health services, for instance, food security, equipment and supplies to continue to run essential services, staffing and coordination requirements by these organizations, core elements that were part of the application process. I certainly can't, speculate as to whether or not if additional resources were made available, what process would be used. I mean, those would be decisions that are decided upon. Definitely, the number of active demonstrated as a significant need.
Thank you. Hey, in your presentation, you talked about economic prosperity being an important determinant of health, particularly when you consider the younger age distribution among Indigenous peoples. One of the things that we've been talking about over the past couple of weeks is the idea that First Nations business models, these models that are limited partnerships, have been excluded from the Canada Emergency Wage Subsidy. I raised that issue with your office back on April the 7th and wrote a letter to Minister Morneau last week. I know there was some funding announced on the weekend that's intended to help small and medium-sized Indigenous businesses, but I can't seem to get any clarity from anybody that will cover off the hole that's been created by them not being eligible for the wage subsidy. Can you identify why these limited partnerships were excluded from that? And is there some plan to make a change and include them in that?
Unfortunately, I don't have that particular response, but I certainly can say that from the announcement this weekend, over 6,000 First Nations, Inuit, and Métis businesses will benefit from those resources through the Aboriginal financial institutions with which they already have pre-existing relationships. However, I will follow up to ensure that a more detailed response to your specific question is provided.
Thank you. I appreciate that. In my riding, I've been in close contact with the Prince Albert Grand Council Vice Chief, and he's been doing some talking, like we've heard from other people, today about the shortage of groceries, baby supplies. There's been some response to that already, but nobody's asked you the direct question, Ms. Gideon, as to what Indigenous Service is going to do to address those shortages that we're starting to find in remote communities that, for example, are losing their winter roads. They don't have access to supplies outside of their communities. There's these remoteness issues. I'm just curious what preparedness that your department is taking for those communities specifically.
I'm just going to see if my colleague, Chad, who has not had a chance to intervene from our regional operations side, would like to jump in on this question.
Sure. Thank you, Valerie. So just a few things on this one very quickly. So first of all, in terms of the winter roads, there was every effort made, as there is every season, to make sure that the supplies that are needed for these remote communities are getting into the remote communities. And in a lot of cases, if not all cases, the supplies that were needed got into the remote communities based on those winter roads. There is also the opportunity in some of those cases to use barges or air transportation to get additional supplies in. You also made up or raised the issue about shortages of groceries, etc. One of the things that is eligible under the Indigenous Community Support Fund is actually supplies, food, etc. That is one of the things that can be used if the Chief and Council so decide from the Indigenous Community Support Fund. Thank you.
Thank you. I'm going to get one last quick question if I can. What is, and I'll leave it open to anybody from the department. What is the department's plan to assist First Nations in increasing testing capacity and tracing after the curve is flattened so that communities can begin to adapt to the next phase of this process?
So as indicated by my colleague, Dr. Wong, we already are making testing available across certainly nursing stations, health centers with treatment, any community that has primary health care sort of capacity on site and wishes to have access to testing. We will support them with access to swabs, with training, or whatever it is that they would require in order to be able to do that, and that will continue. Dr. Wong is working very closely with the Public Health Agency of Canada and the National Microbiology Lab to ensure that rapid testing or point of care testing, when it becomes more broadly available, can be pre-positioned, particularly in remote and isolated communities, but across Indigenous communities where they have the ability to support.
Thank you, Mr. Vidal. We go now to Mr. Fisher. Mr. Fisher, 5 minutes, please.
Thank you very much, Mr. Chair. And as usual, I want to thank you all for being here. Again, one of the benefits we have in this health committee is hearing from experts like yourselves. And I want to thank you and welcome you to the committee. So hello from my dining room table in Mi'kma'ki, where we're fortunate enough in our city to have the incredible Friendship Center, the Mi'kmaq Native Friendship Center over in Halifax. And I believe they've expanded a little bit, bought some land in Dartmouth, and plan to expand a little bit some of the services they provide. Jocelyn, you talked about some of just a handful of the services that Friendship Centers across Canada provide, and I've been somewhat fortunate to see some of this firsthand. And I want to thank you and all of the, I believe, 107 Friendship Centers and provincial territorial associations from coast to coast to coast for what you provide. I'm interested now, during COVID, what have the Friendship Centers had to do to reorganize or change operations to continue to provide those services that you, Jocelyn, outlined in your opening remarks? And what does that do to capacity? Now, I realize that a lot of people are staying home. A lot of the folks that come into Friendship Centers sometimes don't have homes. So maybe, Jocelyn, if you could, or perhaps Christopher, fill me in on some of those changes, some of the ways you've had to reorganize or change the way you normally do things. And I'm also interested in addition, in what things look like now in perhaps a city like Halifax, where we know there are COVID cases, but we only know them by region. So we don't know if folks that are coming into the Friendship Center are actually struggling with COVID symptoms.
Thank you. So that's a lot. This is what we've been hearing from the ground. Immediately, people, the staff of the Friendship Centers, some of them had to physically shut the doors, but a vast majority of the Friendship Centers stayed open in some in some respect. So even though the doors were physically closed, they're still receiving calls, they're still doing referrals, they're still doing the outreach, and they're still doing service delivery in some capacity. So we know that even though people say the doors are closed, they're open. They are fully open. They've just changed the way that they're providing those services. I will say there's some friendship centers that have social enterprises, so the businesses that they're running are losing revenue. They've had to shut down the kitchens, and they had people who were visiting from different communities or there for medical appointments that were in hostels, and they're like, what do we do with these people? Can we get them a flight home? We don't know. So there was some of that. There was a shift to virtual as much as possible, people getting at least some communication out via social media largely. Some friendship centers have housing units, and so they were worried about their tenants, and some of them have very crowded conditions even within those housing units. Some friendship centers have homeless shelters, offer services for those who are unsheltered. And so I think the big concern was for those community members, especially because when you're saying, publicly saying self-isolate, and you literally have nowhere else to go, you're living on the street, the friendship centers are saying, we can't just close our doors because it's unethical. It is unethical for us to close. I've heard that from some of our executive directors. So we have to figure out how to do this safely. They were worried about their staff, about having gloves and masks to be able to provide those services safely to community members. 18 friendship centers have been approached to be testing sites. And I don't know where that's at. That was about a week and a half ago that we collected that information. I don't know if that's been transitioned yet. So they're going to have to physically maneuver and manipulate their physical space to be able to allow to do that testing safely. So we don't know what the cost is. Some of the friendship centers have set up access sites through the windows. So you need access to email to apply for your CERB benefits. Well, I don't have a computer, I don't have access to internet. Well, friendship centers in Manitoba, for example, have set up 2 computers so that you can apply for your benefits through the window. Some friendship centers are the mailing address for people. So how do you close when somebody is relying on you to be open so that they can access mail? So the capacity piece has been huge, because now we're getting to the point where in week 6, the staff's getting exhausted. We're hearing so much from our staff saying, we're tired. We don't know when this is going to end. We don't know when we're going to get help. We're doing the best that we can. We don't feel like we're doing enough. So the capacity piece is really huge. And what we're trying to do at the national office, we've been collecting that information as to what's happening now and trying to relay that as much as possible to anybody who will listen. But we already have our eye to the future to say, if friendship centers aren't able to fundraise for themselves, they can't do their bingos, they can't do their fundraising events, their social enterprises are shut down. So they're not only losing revenue, they're also spending more to be able to get those services and those supplies to the community members. We don't want to have friendship centers that are in financial difficulty 6 months to a year down the line, right? So we already have our eye to how do we make sure that we have friendship centers in the next 6 to 12 months, right? So we're looking already at the recovery process that we need to do to support friendship centers to ensure that they're not going under, because they did everything they could possible to save people's lives. So just to give you a little sense of what we're hearing from the ground.
Well, I suspect my time is probably just about up, but I do want to just take a quick second to thank you for all the things that you folks do at Friendship Centers. And I look forward to seeing a bright, shiny Halifax one. And I hope to be part of that politically someday. Thank you.
Okay, thank you, Mr. Fisher. We go now. Allons-y.
We will now move on to Mr. Thériault. You have 2.5 minutes. Thank you.
Si je ne m'abuse, Monsieur le Président, c'est...
Unless I'm mistaken, Mr. Chair, it's my turn to speak, unless there has been a procedural error?
Non. Alors, je vais...
No?
It's, I'm sorry, who just spoke?
Monsieur Champoux.
Mr. Champoux.
Oh, My information, c'est Monsieur Thériault, mais si vous voulez, avec la permission de Monsieur Thériault, it's okay. Merci.
Je pense que Monsieur.
I think Mr. Thériault agreed, or agrees rather, because we spoke ahead of time. Thank you, Mr. Chair, and thank you to the witnesses for the very interesting light that they're shedding on the situation. Obviously, we're seeing many gaps, inequalities, issues of accessibility to internet. We see that many families throughout the country are struggling. They're struggling with work and studying remotely. My question is for Ms. Gideon. Do you believe that better internet access in rural areas would have helped you to better protect certain Indigenous communities, and how this might have made a difference? There's telemedicine networks that have been in operation for years, such as in Northern Manitoba, Ontario, Northern Alberta. Telemedicine has had a significant impact to improve access to healthcare services. Many communities that have regular visits from doctors, well, doctors are now offering their services more frequently by using telemedicine networks. In British Columbia, there was a recent announcement that virtual services are being set up, coordinated by the province. We are funding the increased costs for telemedicine networks because now there's going to be increased use due to COVID-19. We support this 100%. We support access to the telehealth networks, which are necessary given the current circumstances. Thank you. I have a question for Mr. Obed or to Grand Chief Daniels. Given the situation that we're experiencing, do you think that this will help to solve the injustices and the problems that have been announced for years and that many First Nations communities throughout Canada are experiencing? Do you think that the current situation sheds more light on the urgency of resolving cases like the ones that you have described?
I'm sorry, because of my troubles in getting on, I don't have the access to translation like the rest of you, and I don't speak French, so I apologize greatly for that.
Monsieur Obed?
Mr. Obed, you can go to the bottom. Are you on a PC or on a iPad?
A PC.
So if you look at the bottom of your screen, you'll see a little icon. It says interpretation. If you can click there, you can choose English.
Like I said, I had tech staff help me just to get on, but it wasn't in the formal way, so I don't have access to that particular icon on the way I'm looking. So I do greatly apologize.
Monsieur Shampoo, your time is up, but I'll give you a few more, another quick answer because you weren't able to get an answer for this one.
Est-ce que le grand chef Daniels a accès à la traduction?
Does Grand Chief Daniels have access to translation, and can he answer my question?
Yeah, there's definitely some barriers there. I think that the best course of action, I think going forward, is the emergency preparedness planning that happens here in the region. The regional office has been involved in the emergency planning. There's kind of two sides to this. There's the IST side and then there's the FNIB side. I know they've been brought together, but they're still independent of each other. And so I think that the best process is you bring them together and then you have First Nations do the comprehensive community planning, the emergency preparedness planning, those kinds of things. We always have questions and problems when we look at, or if we assess what they mean by emergency planning. What do they mean by comprehensive community planning? You know, looking at all of the different variables that that produce a community that can produce opportunity and good quality of life. There are those services there. We would say that there's a deficit. There's an intergenerational deficit of underfunding, decades and decades of government administrations just not taking it seriously, not being letting the communities lead this or letting First Nations lead this, and that's always been the problem here. And so what we've always pushed for is for local control, local strategy, and then working at a regional body. We're very close to the ground. We have 34 communities that we work with, Anishinaabe and Dakota Nations. And so we're adamant that when it comes to comprehensive community planning or when it comes to emergency preparedness, we be the ones involved in this and we be the ones who are structuring this because we have the most at stake here. We really, really care about our communities. It's hard to bring in an administrative body that is separated from the community and then tasking them to ensure that the community is prepared. And if you look at the variables being utilized or the different characteristics of the comprehensive community planning or the emergency preparedness, it wasn't enough. It failed and it's failing and it's going to continue to fail until you transfer that responsibility directly to First Nations governments.
Merci, Monsieur Champeau. We go now to Ms. Ashton. Ms. Ashton, 2.5 minutes, please.
Thank you. So my question would be to ISC officials. There was reference to the urgent need for testing kits in the north, in Nunavut, and of course in communities across the country. I know Dr. Wong spoke to this briefly, but how quickly can communities, particularly flying communities, but ultimately all community First Nations and Inuit communities that need them, get these testing kits that can both be used and results can be analyzed in the community itself? How quickly can this be done?
Thank you for the question. At this moment, based on the information from the company, if everything goes well, we are expecting that by early May, that they would have a significant quantity of these rapid test kits that's produced in Canada to be able to start being used in remote areas. And for us, we work very closely with the Public Health Agency of Canada and the Indigenous leaders, as well as the provincial lab system, in order to try to prioritize the remote and isolated areas being the top priority, so that we prioritize the needs of remote and Indigenous communities to get these test kits first. Of course, these equipment needs also training because once it's set up, the staff there needs to be trained. And so we are working with the national lab as well as the provincial lab system and the territorial lab system in order to make sure that those training, does take place. And then there's quality assurance and quality control system built in place. So we are looking at, in a couple of weeks, by early May, that should, the company be able to actually come up with boxes of those equipment and the test kits, that they will be, rapidly, moved to those locations. Thank you.
To ISC officials, again, there have been calls in our region and across northern Canada to shut down work camps and mining sites because they put workers and First Nations at risk. Many of us are alarmed to hear about the outbreaks coming from Fort McMurray. We're dealing with really serious situations across the country, and our regions cannot handle a minimal spread, let alone a surge. Is ISC looking at the need for national leadership around shutdowns of work camps and mining that could put First Nations and our regions at risk?
Sorry, maybe I can start and just see if Dr. Wong or Chad have anything further to add. I think we have certainly offered public health expertise to help support planning and support these particular communities as well that are impacted or nearing those operations to ensure that we can maximize their ability to protect the health and safety of their members through physical distancing measures and limitations of non-essential movements back and forth from community. Dr. Wong, I don't know if you have any more to add, or Chad?
I think that regarding the infection control processes and measures, as well as physical distancing inside those the work environment from a public health perspective, we would be supporting any community in order to actually maximize those measures. As for the shutdown of those facilities, it would be the decision of the province or the territories in collaboration with partners deciding on when to actually shut down or not shut down. So Chad.
Sorry, no, I don't have anything else to add on that. I think you guys covered that well. Thank you.
Great. Thank you, Ms. Ashton. So thank you, everybody. That wraps up our third round of questions. I'd like to thank all the members of the committee for their great questions. I'd like to thank in particular the panel for sharing with us your time and your informed and important expertise. And with that, I'd like to go actually to thank you for the witnesses. I'd like to just ask the committee members to just stick around for a minute for a little brief note about committee business. So we have had a response back from Dr. Alward regarding the WHO. In part, it says, may I express again my regrets to the Honorable Chair and members of the committee that I was unable to accept their original invitation without this having gone through appropriate WHO channels. I particularly regret any inconvenience or frustration this may have caused. I trust that a way forward can be sorted as soon as possible so that WHO might help the committee in its important work. So this is an ongoing conversation. I have Dr. Elward's number. I believe he's in Europe at the moment. I will be reaching out to him later today or early tomorrow, and I will be happy to report back to the committee on in our subcommittee meeting of the subcommittee members on Thursday. And that's all I've got. Thank you. Is there anyone have any comments?
Sorry, Mr. Chair, if I could just quickly, it's Matt. Thanks for sharing that. I think the timeliness of it all is just kind of what we're curious about. So if there's any indication from him in terms of it's going to make the May 1st or not, being away in a different country is something that he's considering. But again, the date was specifically May 1st, so I'll be curious just to see what he has to say to that.
Absolutely, and I think a conversation is in order. I shall try to reach him, make sure he understands what it is we're asking of him, and that he actually doesn't have to be here to do that. And if there are no more, are there any more questions or seeing none? Thank you all, and with that, the meeting is now adjourned. Thank you. Thank you, Erica. Thank you, Sonia. And actually, thank you to all the interpreters. It worked really well. Thank you all.